Let me begin. I know that I've got colleagues from CDSS, Kelly and Linda, I think are on. And let me begin by asking you guys, did I say anything wrong? Or is there anything you want to add to any of the comments that I made earlier in terms of California specific stuff?
Oh, I didn't have any issues.
Okay. Phew, good. I always tell groups, you know, when I talk about things in general, if the state agency says otherwise, then follow their direction, not mine. Let's open it up then. If you have a question, and I saw a thumbs up from Cheryl. So hey, Cheryl, that's a good sign. Also, let's open up any questions, top of mind questions that folks want to raise to begin with. And I am not seeing there where we're a couple of things then as we talk about some of these issues. And hi, Cheryl. And Cheryl, did you want to make any comments initially too?
No, I thought your overview was very helpful and contextual for now. And I think it's true that to the extent that there are specifics that we need to work out, especially between DHCS on that whole Medi-Cal question and us, those are things that are what you consider in the margins that we are still sorting through.
Okay. Yeah, and that whole intersection between Medi-Cal and 4E, just a couple of things there just to keep in mind. And again, the concept is very simple, but the details can be daunting. And there are a lot of detailed things to be worked out. Two additional points that I would raise about that, and then we'll get to Rick's question. Point number one is, even if Medi-Cal pays for a prevention service, can you still claim 4E for case management or other admin services? And the answer is yes. The Children's Bureau has specifically addressed that one and said, yes, that you can still claim 4E admin, even if the prevention service is paid for by Medi-Cal. And there's also an exception so that if Medi-Cal funding would unduly delay provision of service, then can 4E pay it and then get reimbursed by Medi-Cal? And the answer to that is yes. However, that is one of those things that would involve both of the agencies working out those arrangements and one of those kind of sticky detail kind of things that would need to be worked out. Rick, you have a question. Go ahead.
It's just a comment that the state needs to realize. I mean, I agree with you. They're going to have to set up this a new cost pool to keep the admin claiming correct. But I would think that's huge on a brand new claiming system called CCRIS. And then all the coding, new PIN codes that are going to be required. I think this is going to be huge to get it right. And we need to be working on this now and get the CCRIS development team involved. Because I don't know how else you can get a clean discount rate. Anyway, thank you.
Yeah, and I'll just say, and you know, one of the questions that we had earlier is, what have other states done that are already claiming and to be successful there? And part of that is exactly that, you know, amending your cost allocation plan to set up the clear cost pools, looking at your RMS systems to make sure you've got that clearly defined. So those are just part of the kind of the recipes for success. When it comes to the actual claiming practices, once you have your cost pool set up correctly and your way that you identify the costs that are in those pools set up correctly, then the claiming itself becomes fairly straightforward. And that's what other states have found. The other thing that I've seen in some other states, for example, Kentucky and a few others, is particularly some of the former 4E waiver jurisdictions had some advantage in that some of the things that they were doing under waivers were things that they then were able to sustain and continue doing under their Family First Prevention plan. So a lot of that is jurisdiction specific. Other questions?
This is Elisa. Can I jump in quickly?
Sure.
Hi, Elisa Sujihara. I'm from CDSS, Fiscal Policy and Analysis. So I work with Kelly. So I just wanted to make sure I flagged for everyone that the county fiscal letter related to FFPSA Part 1 did go out back in June, I believe, June 1st. And so that letter does identify new codes that are available and mentions that the discount rate is not applied. So we did build that piece into CCRIS already. The piece that's kind of still outstanding is the services components, since that's kind of all still pending CARES. But if you take a look at that CFL, you will see that the discount rate is not applied. And when we set them up in CCRIS, we did not apply the discount rate.
Great.
What is the CFL number?
They actually just put it in the chat for us.
Yep, there it is.
21-22-110.
Great, thanks very much. Other questions? Now, has that, if I can say there is, so is that, the way that's set up, that's already essentially incorporated into your cost allocation plan?
The cost allocation plan should be submitted this month.
Okay.
But essentially what we do normally is just refer to the letter that's already gone out and add all those codes into our different tables that are in our cost allocation plan. So I don't anticipate any huge concerns from ECF, but fingers crossed.
Yeah, yeah, and to say that cost allocation plans don't, there's always a little tiny risk, but you don't have to, it's effective when it's submitted, or in the quarter in which it's submitted, not necessarily approved. So you don't have to wait on approval in order for it to be operative. So that's good. You're essentially ahead of the game there. Other questions that folks have? Folks from CDSS, any further, I think, am I correct that you have gathered information from counties about MOE and that's sort of under review? Is that anything further to add on there?
Could you say that again, Don?
Yeah, a question. I think I saw something that went out where you asked counties for information about expenditures from 2014 that would be part of the MOE calculation. Is that correct?
Yes. So we already sent that out last year, and California has already established the maintenance of effort amount, and we'll be addressing that in a forthcoming CFL.
Okay, so that'll be coming out in a county letter.
Right. So if you actually look at that CFL that's linked, it does mention that statewide it's 2.6 million is what we've established. So I know it's a little bit of a difficult conversation because counties want to know what their portion of that is. But obviously we are hoping that if you submitted that you had costs that were part of that MOE, we're hoping that you've continued that so that new counties don't have to then help meet the MOE. So it really is going to kind of be a after the fact determination to see if those original counties met the MOE. So it does make it a little bit challenging for some of the counties as they're considering building their plans.
Sure. No, that's great. And if I can say, as a non-Californian on the call, for California, $2.6 million is seems like a fairly modest amount to meet. It's not zero, but California is a big state, so you've got an awful lot to grow on there. So one of the other questions that came up earlier was just how do you access and claim 4E for Family First, and it's very similar to how you access and claim 4E for foster care, adoption assistance, or guardianship assistance. There is a reporting system that the state accesses to claim funds, and when your Family First Prevention plan is approved, then it unlocks a portion of that then the state can access and claim those funds. So for prevention services, you have to show prevention services admin and training for Family First, and in that way it's very, very similar to where it works for other things. I see a hand raised with Heather and then Rick. Heather?
Oh, hi. I think Rick was first, so he can go first if you want to.
Rick, yeah, go ahead.
Another question directed to Elisa. So I knew about these codes, but the issue is I'm going to still have costs going to 4E in the CEC. So the question is, what discount rate do I apply? You're going to have to maintain stats in the Cat 8 claim so I can come up with a discount rate. And it seems, I could be overthinking this, but it does seem to me that's going to be very complex.
So since these are candidates, we typically wouldn't include candidates in our discount rate. It's only the in-placement cases. So I don't envision the discount rate calculation changing in any way as a result. We're just not having to apply it to these admin costs in particular.
Okay. It's going to be interesting to see what the discount rate ends up being. Okay, thanks.
If I understand correctly, and Elisa, correct me if I'm wrong, but essentially your discount rate is based on your in-placement cases, and what federal rules permit, say you can either do an eligibility determination on all your traditional candidates, or you can take your in-placement discount rate and apply it to traditional candidacy, and that's what virtually every state does that, including California. So your in-place discount rate, in-placement discount rate shouldn't be affected by this. So it would apply to traditional candidates. It would not apply to Family First candidates. Is that correct?
Yes. Yes, that's exactly what I was trying to say. Thank you.
Okay. Heather?
Hi. Yeah. I kind of wanted to have the chance to double check my understanding of the codes in that CFL and hypothesize about what I think future codes might sort of be, and see if I'm sort of understanding the bigger picture correctly. So in the session a couple of weeks ago, when Dawn explained how there's administrative costs and you can think about them as being case-specific administrative costs, like the case management type of costs, or more like planning and administration, like analysis and planning and figuring out what the frameworks and the contracts and everything is going to be. It seems to me like my read of that letter, of the one that came out in June, is that a lot of those codes are more on that latter type of administrative costs where it's not the case specific work necessarily. Maybe it could include them, but the descriptions of the codes are things that, in our county at least, it doesn't really feel like caseworkers would themselves be doing. It's more like the managers, the analysts, the support staff. But in the future, there might be codes that caseworkers themselves would time study to for the case management, as well as program codes that would be for the actual services. And I just wanted, so that's what I'm kind of imagining in my head. I just wanted to check that with you guys at the state and see if I'm got the big picture right.
Okay, so the question
Yeah.
is, yeah, Elisa?
I was just gonna say, I can take another, take that back and look at the letter again with Kelly. I do kind of see where you're coming from when you mentioned that a lot of the bullets are more of those kind of overarching activities, planning, coordinating. I don't know how much there really is addressed about specific case management in the codes that we have that exist right now. Well, we can look and see if we need to provide some clarity there, but the code does say that it's for federally eligible admin and training activities performed by CWD staff in support of the 4E prevention services. So it may be that you can claim them there already, but we'll look at it again to see if we need to provide any more specificity on that kind of case management piece.
Thanks. Yeah, because just when we read it, we didn't hear, at least in our read of it, like the case manager or the type work in there. But thanks for taking another look. And I have another follow-up question, if it's okay. In the same big picture question, wondering if I'm thinking about this right, that and it may be kind of obvious, but that when there is the point where caseworkers are working on the cases and doing case management, they're going to have to realize when they're doing case management for an FFPSA 4E case versus a case that's more traditional 4E candidacy, right? Because different time study codes entirely. And okay, I just wanted to make sure it's all coming together in my brain. Thank you.
Right. So if you want to access this funding specifically, doesn't have the discount rate applied. Yes, your worker would have to know that you're working with an FFPSA candidate.
So does that imply that in your, assuming that you use something like an RMS to record that activity, that you'd need to be able to differentiate within that the FFPSA case management activity versus some other type of case management activity?
Yes. Mm-hmm.
Okay, other questions? Surely we haven't totally exhausted all the fiscal questions that could be. Okay, so everybody's clear on the claiming processes, what would be involved, all of the those activities. Okay, and we're clear on candidacy, we're clear on identifying pregnant and parenting youth. There is a question in the chat, has the state's plan been submitted yet? And I think the answer to that is yes. But typically what happens is the state submits a plan and then there's a fairly robust dialogue back and forth between the Children's Bureau and the state. Does anybody on the call from CDSS know where that stands currently?
I don't know that any of our program folks are still here, but my understanding is they have submitted a plan quite a while ago and they're still in that kind of negotiation process. I'm not sure the timeline for the full approval though.
Yeah, and there was earlier in the chat, Kush had dropped in the link to the original plan submitted, and you know the back and forth every state, there has never been a plan submitted by a state where the feds have gone, yep, approved or whatever. There's always a dialogue and back and forth and revision. So that process goes forward. So can there is a question here, can case management of Family First be a contracted service? And the answer is yes. You can contract. In fact, there's specific guidance in the federal policy manual about contracting for all facets of development of the prevention plan and monitoring prevention plan, and all of that. Case management can be. The only thing that can't be contracted is the determination of candidacy has to be a 4E agency determination. But other than that, that is permissible. It can be a, it can be county social worker, it can be a provider providing case management. That's really up to the county to determine how that can best be accomplished.
Sorry, let me clarify my question. I was asking about the state plan, the revised state plan, after we got the revisions and we made the revisions. Had we submitted that yet or not? I know we had originally done that on August 4th, but I know we got it back and then we were making changes. So I wanted to see if that had been submitted already or not.
I'm checking to see if we can get an additional CDSS staff person to confirm that. Should have something momentarily. Don, are you certain?
Yeah, I don't know the answer to that.
I'll see if I can track somebody down real quick.
Okay.
Yeah, and I know I've been working with Kelly on trying to figure out, the CFL came out, CFL, the one time with the claiming instructions. We're trying to figure out if case management is going to be included in any of the codes, because I know case management wasn't identified as a claimable activity for based on the CFL. So I know we're waiting on a response from CDSS on that. So that'll help us as well in planning and preparing our claiming.
I saw Kelly nodding there. Is that correct?
Yes, so we're in the process of getting that question approved right now. I'm hoping to have it to us by the end of the week.
Okay.
Perfect.
Right.
Thank you, Kelly. I appreciate that.
Okay. Question from Rick. Is it fair to say that someone in foster care cannot have any cat aid claims to FFPSA? So Claire, tell me what is, I'm not familiar with cat aid. Is that?
Oh, sorry, just a second. So, with that, the cat aid is when you charge out, there's payments made to the parents during their foster care, and those go on a claim that are separate from admin.
Okay.
So, and that's why maybe my issue related to the discount rate is not of much concern, because since they're already in foster care, you can't consider it to be preventive services.
Yeah, that's correct. The distinction that the feds have made pretty clearly is for candidacy. A candidate is a child who is at imminent risk of entering foster care. If a child is already in foster care, then by definition, they cannot be a candidate. So the only children in foster care for whom the prevention services would be relevant would be a pregnant or parenting youth. Heather?
You just answered my question. I was wondering about the pregnant and parenting youth. And I guess in that situation, it's the child of the youth who's the FFPSA candidate, or is it that the youth themselves are really a candidate in both situations?
Well, the youth is eligible for prevention services. They're not a candidate, but they are eligible for prevention services. It is just a separate category of eligibility. So you don't really have to worry about whether or not the child is a candidate, because the youth is eligible for prevention services as if they were a candidate. And it's just a categorical eligibility. And the other thing is that the term pregnant or parenting youth is to be defined in the state's Family First Plan. So that's however the state defines that. And so there was Dana, did we get any response on the?
I am still waiting on a response from someone from CDSS. I'm hoping to have somebody shortly.
If not, we can include that in the follow-up information. Okay, we've got just a couple of minutes left. Any burning or even simmering questions that we need to address before we conclude?
I did just get a response from Cheryl Treadwell. Cheryl said that they are planning to resubmit by the end of August.
Okay. Okay. Well, so first of all, I just want to say thanks to Elisa and Kelly and for joining us and providing additional information. And as folks have additional questions, then continue to feed those to us, and we will certainly. This is not the last opportunity for those. And there is a link in the chat now on how to register for the next Learning Forum on July 20th. And the past one and this Q&A were the first of a whole series of things. So in terms of your efforts to prepare for implementation of Family First, and wish you all the best in that. So I think that concludes our activity. Thank you very much, and wish everybody a good rest of your day. Thanks.